So, good morning, guys. Today I'm going to teach about the analgesic drugs. So, what are the analgesic meaning? First, the drug is selected relieving the pain by acting of central nervous system or peripheral pain mechanism. So, without CDP already consciousness. So, daily we can take the analgesic and painkillers and all we are taking. That is the analgesic. Anesthesia means total paralysis. So, anesthesia means it's a loss of sensation, and anesthetic agents one which bring about loss of modalities of sensation, particularly pain, along with the reversible loss of consciousness. So pain is so medical term is allergia. Allergia is unpleasant sensory and emotional experience associated with the actual and potential tissue damage. So describe the such a such a damage. Okay. So classification it's a opioid analgesic, non-opioid. So opioid means narcotic and morphine that is under like analgesics. Non-opioid means only anti-inflammatory drugs. So non or narcotic and aspirin like analgesics. So opioid means natural opium is there, semi-synthetic, then synthetic. Natural opium means morphine and codeine. That morphine you can see that OT. Okay, so semi-synthetic means diacetylmorphine, then oxyformamine, then phenoclomidine. Okay, so synthetic means bethadine, fentanyl, methadone, so dextropropoxifene, then ethanoepatizine and tramadol. So this is under synthetic. It's normally used for surgical ward. Then non-opioid analgesic means it's a non-selective cause inhibitors. So here salsalitis means aspirin, salsaliclamide, then Benalot and diffusional. So example only you can take salsalic means aspirin. Then pyrazole and derivatives means butazone. Okay. So then propionic acid which means brofine, then naproxen, oxyprocin, ketoprofen that is under profine and all is a propionic acid derivatives. Then indole derivatives means it's a indomethacin. Then athalonic acid derivatives means mefonic acid and fumanic acids. So aryl acetic acid derivative means diclofenac. So oxycodone derivative means tensicum and pyroxicum. Okay. Then here preferential Cox inhibitor means nimesulide, then naloxone, then nabubuton. So selective means Valdixcops, Silicope, then Robacox. Okay, so analgesic with the proof anti-inflammatory actions. So para-amino phenyl derivatives, it's a paracetamol, then pyrazole derivatives means adazolamide, then pyroperazole, then benzoxazine derivatives means Nibofam. Then pharmacological action CNS means depressant and stimulate action. Then CVS means causes for vasodilation. Then GIT means constipation. And smooth muscle means increase the uterine contraction and bronchoconstriction. ANS means mild hyperglycemia will be there. So what are the adverse effect means GI doctor the epigastric distress will be nausea, vomiting. It's a common. Then peptic ulcer. So this is another common symptoms. So here blood loss in the stool will be there if you are taking. So normally if you are taking this all the opiates and all. So allergic reaction is not common. Okay. So photosensitive is like this hemodialysis, nephrotoxicity, Ryu syndrome means influenza. Okay. So cyclism and acute septic intoxication. So what are the uses means it's acute and chronic condition which is inflammation is present we can use. So rheumatoid arthritis, osteoporosis and inflammatory arthroposis, acute gout, then dysmenorrhea, metastatic bone pain, headache, migraine, postoperative pain, mild to moderate pain due to inflammation of the tissue injury, pyrexia, renal colic. So we all this all condition we can use for opiates. So rule of opiates means it's a promote development and modulate and regulate inflammatory cell function. Then can introduce a pain, edema, redness, vasodilation when they are introduced for other medication. So PG interpretation means release the during the phagocytosis. It's a hemotoxis, inhibit the chronic proliferation, macrophage stem cells, migration, macrophages on lymphocytes, suppress transfusions. The general condition ulcer will be there, asthma, patient with nasal polyp, diabetes, cold, influenza, hypocoagulation state, chronic allergy disorder, then chronic liver disease, renal failure, then allergic breastfeeding mothers, pregnancy contraindication. So aspirin means acetylsalicylic acid. So we can use the analgesic, antipyretic, anti-inflammatory action. Metabolic effect means blood sugar may be decreased, plasma free fatty acid will be there, cholesterol level reduced. Then respiration means hyperventilation will be there. So acid base and electrolyte balance will be algorithm will be changed. Serious vasodilatation and increase the cardiac output. Jigging means heavy gastric distress, nausea, vomiting. Blood means prolonged bleeding time will be there. So whenever we are giving aspirin, then heparin group of drug and all, we can check blood test, then only we can give. So adverse effect means nausea, vomiting, epigastric distress, increased blood loss in stool, rashes, then fixed drug irritations, urticaria, rhinocardia. So normally dizziness, tinnitus, vertigo, impaired hearing visions, mental confusion. So everything will be there. So uses for what are the uses we can give? Analgesic, antipyretic, and rheumatic fever, rheumatoid arthritis, osteoarthritis, post myocardial infarction, patient ducts arterios, familial chronic trophies, prevention of colon cancer, and treatment of battery syndromes. So what is the meaning of battery? So battery syndrome means what? Means that battery syndrome is it's a renal tubular fluid disorder. So they can't reabsorb for salt, okay, for sodium. This is battery syndrome. Then precaution and contraindications: peptic ulcer, bleeding tenderness, children of chickenpox influenza, chronic liver failure, diabetes. So 6 to 6.5 hourly orally they can give. So commonly available 350 mg of aspirin, Disprin 350 mg, Colosprin 130, then Ecosprin. Okay. So then normally if you are giving aspirin group of drugs, we can check blood clotting time, then prothrombin time, then international ratio, normal ratio time we can check. So then brufen, ibuprofen means it's a prophenic acid derivatives, normal gastric discomfort, nausea, vomiting, headache, dizziness, burning, vision, tenderness. Then avoid pregnancy, peptic ulcer patient can give, we can avoid. So what are the uses? Mean analgesic, antipyretics, rheumatoid arthritis, osteoarthritis is a common postpartum and postoperative swelling, inflammation they give it. So dose for 400 to 800, three times they will give. So commercially available for brufen, ibiflom. So this is 200, 400, 600 and will be there. So diclofenac sodium. So diclofenac means it's oral acetic acid derivatives. It's a well absorbed only. The plasma 1.5 hours to 2 hours they can give. So adverse effects means epigastric pain, nausea, headache, dizziness and all will be there. So use the same rheumatoid arthritis pre-op and post-op patient we can use. So normally 50 mg TDS we can give, otherwise orally they will give. IM for 75 mg they will give. So commonly used for diclofenac, diclofenac, monavac. Then ketorolac. Ketorolac means biroperal derivatives. It's a potent analgesic, modest anti-inflammatory. So rapidly they absorb the oral. Then IM administration. There is take 1.5 hour to 5 to 7 hours plasma times. So what are the nausea, effects? Means nausea, abdominal pain, dyspepsia, ulceration, loose stools, drowsiness, headache, and all normally will be there. Then pruritus. Sometimes itching and all will be there, that is pruritus, and fluid retention will be. What are the uses? Means it's a post-operative acute musculoskeletal pain. It's a 15 to 30 mg IM. Every 4 to 6 hours they will give. Okay, so it's a renal colic used for, then due to pain for bony metastasis, and orally they will give for 10 to 20 mg 6 hourly. So ketorol, kentanol, torolacandol they can give. Nimesulida. Nimesulida it's a preferential Sivox interpretation. It's used for lasting painful inflammatory conditions to dental surgery, then low backache, dysmenorrhea, post-operative pain, that is another they can give. So they will give for 2 to 5 hours. So it's excreted to the urine only. So what are the options? say heartburn, nausea, loose motion, pruritus filter, hematuria, and hepatic liver failure for few cases. So use of asthmatic bronchospasm, intolerance, aspirin, which will be the dose 100 mg BD. And then conclusions. So analgesic is definitely using for reducing the pain and improve the quality of life, but there is a whole spectrum of adverse effect will be. So no single drugs superior to all the every others, all for every patient. So choice of drug in especially empirical. Okay, thank you guys. So just what are the drugs will be there, you can check. Then basically what are the seeing in hospital side, the ICU and surgical side, what are the opiates they're using, just keep the mind and remember that side effects and write. Okay, thank you guys.